Hello, Charlestown. Welcome to our show. I'm Carol Jones, and I am here with Dr. Raymond Barr, who is a cardiologist from St. Agnes Hospital. Dr. Barr was here several weeks ago and did a presentation on IHAC.
EHAC.
EHAC. Okay. Anybody know what EHAC is?
Very good.
Early Heart Attack
Care.
Unfortunately, there was a holiday and there was a mix-up in the scheduling and not too many people were there. He has graciously agreed to come back and talk to us again. First of all, just what is this EHAC?
Well, it's early heart attack care, and most people are not aware of it being present. But it's a strategy and a movement that was started at St. Agnes back about 1981, and now today has moved across the entire United States and is about ready to go into action steps in order to reduce heart attack deaths in the United States. I think before you even start thinking about heart attacks, I think it's important to understand the heart, because the heart is a miraculous organ. If you think about how do you measure the heart, you measure it in terms of perhaps beats or the volume that it puts out or what it can do for you in a lifetime. And beat-wise, if you think about it, it beats 60 times a minute, 60 times an hour, 24 hours a day, 365 days a year. Now, if you measure the amount that it beats for you in 1 year, the number is 31,536 thousand. And if you multiply that number times your age, you get the number that it has beat in your lifetime. Now, I'm 82. So in my lifetime, my heart has beat 2.5 billion beats. And volume-wise, it beats about 100 we call it cc's an hour. But if you measure that in quarts and the like, you will find out that it beats 3,153,000 quarts a year. Now, if you multiply that by how old you are, I'm 82, you come up with 260 million quarts in my lifetime. Now, that's a lot of beating. But even more importantly is how the heart works. The heart happens to have tremendous capacity. It can, if you run up a mountain, like in Australia, it can go 40 times the normal output. And it does that because it has what they call the Frank-Starling curve. So whatever is returned to the heart is able to beat out. So you don't know it all day long when you're increasing activities and things like that. The heart is just beating and producing and giving you what you need. It needs to do that because it needs to pump oxygen throughout your body in order to have your body, the different organs work properly and the like. So the heart is a miraculous organ that you need to take care of. It needs to be appreciated. So before you even get to heart attack, it's important to truly appreciate the heart. And we have a video showing the heart beat. And the heart is unusual because it has two pumps. It has a pump that goes to the lungs that gets rid of waste products, CO2, and brings in oxygen. But then it comes back to the second pump in which blood comes back to the heart and it needs to pump it out. So it has two pumps working together. And if you look at the heart pumping, it's almost like you can't understand how it does it. And in fact, at one time, William Harvey, back in the 1500s, stated, I almost believe that the motion of the heart was to be understood by God alone, because it's incredible to see the motion of the heart and the fact that it's able to beat, in my lifetime, 2.5 billion beats and the like. So before you even get started about heart disease, I think it's important to understand the beauty of what you have within your chest. If you had to buy a heart off a grocery shelf, it would probably cost the neighborhood of $2.5 to $5 million. So if you have that valuable mechanism within your body, it's important to know you want to take care of it. You want to know when it's in trouble, when there's a noise in it. If you had a Mercedes car and it had a motor, if you had a new noise, you check it out. Well, the same thing with the heart. If you appreciate the heart, you're more able to prevent problems from occurring. So the number one problem that occurs with the heart that damages it is heart attack. And I don't want to get to all aspects of it, but there's vessels called coronary vessels that supply oxygen to the heart muscle. And if these vessels are interfered with, blocked, and this is with a disease we call hardening of the vessels or atherosclerosis, there's a buildup of cholesterol-like plaque, and then there's a tear, then there's a clot coming in, and then there's platelets coming in. And what this happens, the heart, then the coronary vessel blocks off, and then the heart muscle dies off, or the individual dies. So it's important to know that the number one problem with the heart is heart attack, and it kills almost 700,000 people each year in the United States. So the question is, what can we do about it? Well, at St. Agnes, we were making rounds a long time ago and found out that patients, before they had the big one, the big chest pain that brought them into the hospital, they had, for 2-3 days before, discomfort within the chest. And this discomfort would be a fullness, an ache, burning, a pressure that would occur off and on with activity, and would go away with rest. And people would put up with this, put up with it until it became the big one. Many times in the emergency room, when I saw a patient with a heart attack, I would say, "What happened?" "I got the big one." But if you then talk to him or her, you would find out that they had symptoms off and on for 2-3 days before they came in. And over the course of a couple of years, we said, well, where's there a program for this? How do we teach the public? And even though people knew that there were symptoms ahead of time, there was no program, within the community or across the United States to deal with this. So somewhere along the line, we said to ourselves, we have to do it. So we started a program at St. Agnes called Early Heart Attack Care. Focus on the early symptoms. Get people in early to prevent. Again, appreciation for the heart, but when it's in trouble, do something immediately, because you can prevent the heart attack from occurring, you can prevent death of muscle, but also death of the individual. So we started this program at St. Agnes, and have carried this program across the nation from St. Agnes for 10-15 years, and then we developed an organization, the Society of Chest Pain Centers, that delivered it for 15 years. And just within the last couple of years, the American College of Cardiology has taken us over. Now they have the message of early heart attack care. Now, it's important to know also that when you come in with early symptoms, the problem in the past has been that ER physicians would say, well, you don't have enough pain to come in. So there would be people driving around in the parking lot waiting for their discomfort to become painful enough to come into the emergency room. Can you imagine? So when they should have been coming in, to prevent it, they were coming in late. So we tried to get this program out, not only to the community to come in early, but also to the emergency rooms. And we started what they call chest pain centers. And its emphasis has been, yes, to take care of patients coming in with full-blown heart attacks, but also to be appreciative of those with early symptoms. The acronym used to be GOMER, get out of my emergency room unless you got severe pain. We changed that. It's now, thank you for coming in early. We appreciate that because we're going to check you out. So we aligned these chest pain centers with this community program called Early Heart Attack Care and combined them. So this program is going throughout the the United States right now. On our website, we have this early heart attack care course, and if you take it, you take an oath at the end of it that you will, if you have come upon somebody with early symptoms, you will stay with that person until they get into the hospital. You take an oath. And now we have 947,000 who have taken this oath. We will have 1 million by the end of this year. We will have 1 million people ready to, in the community throughout the United States, if in the presence of someone with early symptoms, will stay with them until they get into the hospital. That's how we're going to make a dent in the mortality of 700,000 deaths each year in the United States. Since this occurs in about 50% of the patients, we could conceivably save 350,000 lives each year in the United States with this program. So that's why at the end of this year, when we get to 1 million deputies in early heart attack care, we will have also 1,000 chest pain centers in the United States. And a combination of the two, it's going to be the force that will reduce significantly heart attack deaths in the United States.
I got a question.
Shoot.
I'm having chest pain, but I'm not sure that it's enough. Instead of riding around, I go to the emergency room and I see you. What are you going to do for me?
Well, first of all, we get you in, and we get you in quick, and that's what chest pain centers are all about. They get you in quick, and they put the EKG to you, and they take your history. Your history is more important than the EKG. Many times your EKG is normal, but what happens is we do blood tests on you, and then we do other studies on you and find out if you're in the midst of having a heart attack early. And at the same time, because of the significance of the history, we are medicating you with agents to block the platelets and block the clot formation and to slow the heart rate down in order to protect you during a period of time. And then at some point in time, we will take you to the lab and do a catheterization to find out if you do have it and where is it, and can we do something about it by putting a stent or something like that. Now, if it turns out you don't have it, that's great, because you came in at a stage where you might have had it, and it's better to be safe than sorry. Right. And it is true that you could have other reasons for chest discomfort. You could have heartburn from GI distress. You could have many other reasons for chest discomfort. But the one that kills you and maims you, destroys muscle, is your heart. So you have to respect the heart first. That's why in the emergency room, there's a special place for chest pain, the chest pain center. And 1,000 hospitals in the United States have those right now. It's thank you for coming in. Let us check you out. Let us prevent something from occurring.
So I'll also get education.
Oh, education is part of that. And we get into the risk factors, but the risk factors are risk factors to prevent you from having hardening of vessels and heart attacks down the line. But chest discomfort is a real risk factor right there and then. So it's chest discomfort before chest pain. It's the smoke before the fire. You know, it's appreciation that half the heart attacks have these early symptoms, early heart attacks care symptoms. And this program was started at St. Agnes. We put a lot of emphasis on the community aspect, and also by standardizing the emergency room to be appreciative of early discomfort. And the combination of the two is what the American College of Cardiology now is helping us to promote throughout the United States. So we're excited about it.
And you should be.
Thank you. So essentially that's it, is to appreciate the heart for the tremendous, miraculous organ that it is and what it has done for you. Just take those numbers and multiply it by your age, and you'll see what it has done for you. But what's important is to know that it has functioned whatever your needs are. When you run, when you go up steps or alike, it responds. It gives you the output to go along with the amount that's coming back to the heart. And most of the time, you don't even know it. Now, if you want to know, you can put your, when you're down, when you sleep at night, put your head to the pillow, and you can hear it beating, and then you can also feel the pulse, the amount it's beating, by taking your pulse, and that's a way of measuring the volume that your heart is beating. So I think if you appreciate the heart, you want to take care of it, this $5 million structure within your heart. And you, if it's in trouble, and we talked about this earlier, the major reason why people don't come in is denial. Denial of the person, because they don't want to, I hate to say it, they don't want to call the ambulance in the middle of the night, but that's when you die.
Yeah.
So it's denial in the patient, denial in the first responder, because the first responder will say, yeah, that's probably indigestion, John. But now, this early heart attack caregiver will stay with the person until they get in. We call it deputy because in the old days, in the West, the sheriff had 2 deputies. But when there was a crisis, they deputized everyone in the town. Well, that's what we're doing with EHAC right now. We are deputizing everybody in the nation. And that's what this badge is all about. When you take that pledge, is to be part of the solution to the problem rather than part of the problem.
Yeah.
And we're deputizing everybody into action. And then in 2019 and 20, we will have the entire nation involved with that. Now, how do you know we're going to be successful? Well, in cardiac arrest, which is one of the 3 ways in which heart presents itself, and there's a video that is going to be played showing the 3 presentations of heart attack. One, the person with a cardiac arrest. One, with the person with a severe chest pain that is in throes of a definite heart attack. And one in which the symptoms are off and on, but going to go on to a heart attack. So the emphasis is getting the person early. Not all heart attacks are created equal, and what we want to do is put emphasis on the early aspect of it.
Well, when you think it's the fact that it's the #1 killer, heart disease, and heart attacks are the big thing. As I said earlier, we're really fortunate here because we've got great security. They all have their little knapsacks on their back that they can, do what is necessary, and they're very good about let's transport the person and take them and get it taken care of.
And the important thing is, as earlier as possible, if they got unexplained symptoms in the chest, coming and going, get it checked out.
Now, what symptoms are we looking for?
We're looking for, if it's pain, then everybody knows you got to get in. But if you got chest discomfort, if you got pressure, you got an ache, it's a burning, and it's the middle of the chest, and it comes and goes, especially with it's worse with activity, eased by rest, and unexplained. Rather than be quiet and say, I'm going to take 2 aspirins and go to bed, you get it checked out. Because in the Reader's Digest article, I had many people write us and tell us about dad or mom took 2 aspirins and they were found dead in bed the next morning.
Yeah.
When someone is not acting right and has a little bit of discomfort and they want to lay down, get involved. Ask some questions.
Now, is it the same for men and women?
Well, basically it is, but women have somewhat different symptoms. A lot of times they have shortness of breath rather than discomfort itself, or just weakness, unexplained weakness that comes on them and the like. So unexplained weakness or a little bit of shortness of breath and new onset, women should check that out as well. And if you go to a hospital with a chest pain center, they say, thank you for coming in. They take you right away. They don't put you, when I started, they were putting you they weren't getting you into the emergency room.
Yeah.
And we had to tell our patients with heart disease, heart attacks early, is tell them you're bleeding in order to get in. In other words, tell them it's an emergency.
Yeah, yeah.
But now they treat the early discomfort as an emergency. And that's what we did with these chest pain centers,
Yeah.
is to respond to the needs in the community. And that's where The heart of the problem is in the community. That's where heart attacks begin, fester, and are often on, something is going on until they get the big one where the vessel is occluded. And then they come in and we spend all of our time, effort, and money trying to open a vessel that's closed. Why not prevent the vessel from closing? If it's a $5 million heart and is doing a lot of work for you, appreciate the heart. And this is what I call appreciation prevention.
Well, Charlestown, you heard it here first.
Thank you for having me.
We're delighted that you came. We hope that we don't see you over at St. Agnes. We'll try to stay away, but if we need to, we know who to ask for.
Well, I retired about 15 years ago, but the chest pain center there is still as active as when I left there.
Well, good, good. But thank you again for being with us.
Thank you, Charlestown.
And thank you, Charlestown, for listening. We hope you found it informative and helpful. If you have questions, contact the studio and they will route you to where you can get the answers. So have a great day. Take care. Thanks for listening.
Thank you.
Bye-bye.
You know, there are three kinds of heart attacks. There's the one which have cardiac arrest. Everybody knows that, and everybody knows what to do. You know, there's peer pressure. You can't walk by a cardiac arrest without saying, are you going to do something? Okay, and then there's a person who looks at you and he's been a strong person, but now he's looking at you. He looks weak, he's sweating, and doesn't look well. And a lot of times he's holding his chest and squeezing his chest, and that's called a Levine sign. That's the telltale symptoms of a person with a massive heart attack. He's got a blocked vessel. If he doesn't get into the hospital within a short period of time, he will die or he will kill half his muscle and the like. The third presentation, which occurs in half the patients and can occur for a couple days before, we call it stuttering MI. And what's happening is the vessel is clotting but dissolving, clotting and dissolving. It doesn't know which way it's going to go, but it's telling you some symptoms, and the symptoms are this. It's not pain. Patients will not come in because it's not pain. They'll wait until it becomes pain. But before that, they have this chest discomfort. It's not pain, but it's a new onset chest discomfort in the middle of the chest. It's burning, fullness, and ache. And what really is upsetting is the fact it doesn't stay. It occurs off and on, comes and goes. So you have it for 5–10 minutes, it goes away. 2 hours later, it comes back. So you put up with it, and then you say, you come home that day and you say, I'm not feeling too well, let me lay down. And the wife finds him dead in bed the next morning. And that's the ones we want to get to, because that stuttering is telling you that that person needs to be seen right there and then. They're getting ready to have it. This is what we call early heart attack care. So it's similar to the area is where the chest pain is, but it's chest discomfort. And because it's mild, because it's intermittent, it's not addressed with great importance. And what happens to the person in the midst of that? That person doesn't have to do anything because there's no peer pressure. There's no one saying you got to do something. So if your friend says on the golf course, you know, I'm not feeling too well, I've got this since this morning, I think it's coffee, and they sit down a little more on a fourth hole or something like that. A lot of times the person with them becomes an enabler rather than a caregiver. And they say, well, yeah, it's indigestion. Why? Because that person's got as much to do as the other person. They're on treadmills, we're all on treadmills. So no one wants to take time out because they are afraid, they're hoping that's not the big one. When they come in sometimes, they've had these stuttering symptoms, they know, I got the big one. They've known all the while, they just put it on the back burner. So we're trying to tell the people, you don't put #1 killer on the back burner. You pay attention to it. And also the person in their midst says, I know I got things to do, but I'm going to take you to the hospital and get it checked out. That's our message, is to get people aware of this #1 killer and get, not only be aware of it, but do something about it and come into a place that's prepared. Thank you for coming in. Let us check you out. And the first chest pain center with the observation was here at St. Agnes.